Hi, a very good morning, class. I hope all of you are doing great today. So in today's class, we're going to learn about type 1 diabetes. So before I explain further, I'm just going to show you guys a very nice video that you guys can understand.
Here are a few clips on our interview with diabetic patient and her sister.
Hi, I'm Nadia, 17, and I am type 1 diabetic patient. I was diagnosed with type 1 diabetics on June 27, 2015, and it has been 6 years. Before being diagnosed, I awoke thirsty every night, and many empty water bottles piled up in my room for the last 10 nights before being diagnosed. I noticed that, so I told my sister, and we both decided to go to the hospital for a checkup. Yes, my grandmother has it, but she is diagnosed with type 2 diabetics. There is a difference between type 1 diabetics and type 2 diabetics. The main difference is the underlying mechanism that causes the blood glucose level to rise.
I always seemed so tired almost all the time, and I could see that she became thinner day by day. I realized that when I hug her I can feel it, but sometimes she became extremely hungry. This made me feel curious, like what had happened to her. So I searched on Google and it said that all of these were the signs of diabetes type 1, so I decided to go to the hospital as soon as possible.
Some basic introduction on type 1 diabetes with the endocrinologist.
Hello, I'm Dr. Hannah and I'll be explaining the meaning behind T1D. Type 1 diabetic is typically diagnosed in children and adolescents whose bodies are unable to manufacture adequate insulin. It is a chronic or long-term condition that necessitates ongoing care. People between the age of 30 and 40 more likely to develop late-onset type 1 diabetes. In type 1D, the body doesn't make enough insulin due to a cell-mediated immune response, which is when our T cells attacks the pancreas. Insulin is used to reduce blood glucose level that is secreted by a beta cells in the center of Ehrlich-Langerhans in our pancreas. T1D patients have a genetic abnormality causes a loss of self-tolerance among the T cells, which targeted the beta cell antigens. When the self-tolerance is lost, T cells will recruit other immune cells and coordinate an attack on these beta cells. Losing beta cell means less insulin, therefore glucose piles up in the blood as it could not enter the body cell. Interestingly, people with T1D often have specific human leukocyte antigen genes, HLA, in common with each other. One is HLA-DR3, another is HLA-DR4. However, not everyone with these genes will develop diabetes. Having high blood sugar will damage body, causes various symptoms, and even diabetic complications.
We go deep to the pathogenesis with Dr. Stephenie.
One of the endocrine functions of the pancreas is to secrete a hormone called insulin into the blood. Microscopic regions of beta cells in the pancreas are located in the islets of Langerhans. These beta cells release insulin hormones. The insulin molecules leave the beta cells and travel into the bloodstream to regulate blood glucose levels. After a meal, increasing amounts of glucose in the blood trigger beta cells in the islets to secrete the appropriate amount of insulin hormone, which travels through the bloodstream to target cells where it promotes the transport of glucose into the cells. Certain tissues such as skeletal muscle and adipose tissue require insulin to unlock their cells before glucose can enter. Type 1 diabetes is a condition in which your pancreas does not produce insulin, a hormone your body needs to maintain proper blood sugar levels. After you eat foods that contain carbohydrates, chemicals in your small intestine break them down into single sugar molecules called glucose. Next, the cells lining your small intestine absorb the glucose, which passes into the bloodstream. When the blood reaches your pancreas, beta cells inside your pancreas detect the rising glucose levels. The beta cells release insulin into your bloodstream to reduce glucose levels and to keep your blood glucose in a healthy range. Most of cells of the body have a certain receptors on their surface that bind to the circulating insulin. Insulin acts like a key in lock to open up the cells so that the circulating glucose can get inside the cell. Now, your cell can use the glucose to produce energy it needs to function properly. Now, if you have type 1 diabetes, your pancreatic beta cells lose their ability to produce insulin, resulting in high blood glucose levels and other complications. In type 1 diabetes, your immune system, your white blood cells, mistake your pancreatic beta cells for foreign invaders. In autoimmune response, your white blood cells secrete autoantibodies that destroy your own beta cells. As a result, your pancreas produces little or no insulin. Without insulin, glucose cannot get into your cells. So, they are starved for the calories they should be reserving from glucose. In addition, the glucose level builds up in your bloodstream, resulting in a condition called hyperglycemia.
Every disease must have a diagnostic method. In type 1 diabetes, there are 3 commonly used.
So now let's look into the first diagnostic method, which is HbA1c test. HbA1c can be known as glycated hemoglobin, as it happens when the hemoglobin that carries the oxygen joins together with glucose in the blood. Here stated on the slide the average measurements, some conditions that can make the HbA1c test becomes inaccurate, such as people that suffer from anemia, pregnant ladies, and having some illness. HbA1c differs from blood glucose level test because HbA1c is a test that indicates the child's average blood sugar level for the past 3 months, while a blood glucose test indicates the blood glucose level at that moment itself. The blood is taken from the vein and sent to a lab for analysis. If blood is taken from a finger prick, this is used only for monitoring treatment plan and not for diagnosis or screening method. The diabetic patient have to meet the endocrinologist regularly, and the doctor will monitor its HbA1c results. Within this test, the doctor may observe if the diabetic patient needs to change their insulin regimen, meal plan, or even both. Blood and urine samples will be taken periodically to check on the cholesterol levels, thyroid function, liver function, and even kidney function. The presence of ketones from the breakdown of fat in the urine suggests type 1 diabetics rather than having type 2 diabetics.
Random blood sugar test. Random blood sugar test is a test that is done by withdrawing a blood sample at random, and the results may be validated by repeated tests. And this test, the results are measured in milligrams per deciliter or millimoles per liter. And this test does not require fasting, and it can be done at any time and anywhere, such as office, clinic, or even at home. Usually, when the result indicates 200 mg per deciliter or greater than that, it suggests that the patient has diabetes, especially when combined with any of the other signs and symptoms of diabetes. Glucose test results may be influenced by exercise. Exercise in general lowers the glucose level. If you are on intense insulin therapy, you may even need to change your insulin regimen. The next test is fasting blood sugar test. Fasting blood sugar test is usually done by an overnight fast with a period of 8 hours without any food or any glucose drink intake. The patient is only required to have water. The results, which is less than 100 mg per deciliter, are considered to be normal. And now, the results, which ranges between 100 to 125 mg per deciliter, usually indicates that the patient is having pre-diabetics. And now, when the patient is having 126 mg per deciliter or above than that, it means that patient is already a diabetic patient. And usually, this test is influenced by the foods that the patient has consumed, or by the stress level and the medications that the patient is consuming, and by the activities that they have done.
After being diagnosed, treatment is to ensure a healthy lifestyle.
If you have diabetes type 1, you must take the insulin because your body no longer makes the hormone. You need to take insulin several times per day. Several types of insulin are available. Each type start to work at a different onset and its effect lasts a different duration. Most types of insulin reach a peak when they have the strongest effect. Then the effect of the insulin take over the next few hours. When you want to take the insulin may depends on your lifestyle or preference. You can talk with your doctor about it. Two common ways to take the insulin. So this is insulin pen. It looks like a normal pen but has a needle for its point. Some insulin pens come filled with insulin and are disposable. So insulin pens are more expensive but many people find them easier to use. Next is insulin pump. It's the small machine that gives you steady doses of insulin throughout the day. You wear one type of pump outside your body on a belt or in a pocket. The insulin pump connects to a small plastic tube and a very small needle. You insert the needle under your skin and it stays in a place for several days. So the insulin pumps from the machine through the tube into your body 24 hours a day. CGM automatically track the blood glucose day and night, so you can check your blood glucose level anytime that you want. You can also review how your glucose changes over a few hours or days to see the trend, so you can help yourself to decide how to balance your food or physical activities. A CGM works through a tiny sensor inserted under your skin, usually on your belly or arms. So the sensor measures your interstitial glucose level. A transmitter wirelessly sends the information to a monitor, and the monitor may be part of the insulin pump.
Okay, first of all, proper diet is very important for diabetic type 1 patients, but at the same time, you also need to understand that there are no such a thing as a diabetes diet. Because for diabetic type 1 patient, they only need to be aware of their blood sugar level. Since their body cannot produce insulin, they have to be careful of how much intake of carbohydrate in their meal. So basically, any food that contains carbohydrates, once it's consumed by us, our body will break down the carbohydrate into simple sugar. For example, glucose. The glucose then will be absorbed into our bloodstreams, and our body needs insulin to move them from the blood to be used for energy. So, since diabetic type 1 patient cannot produce insulin in their body, the glucose will keep accumulating in their bloodstreams and eventually it will cause hyperglycemia. But thankfully, they can pump insulin into the bloodstreams, and that's why they have to make sure that the amount of food intake is matched with the insulin doses. Well, as I said earlier, there's no such a thing as diabetes diet, which means you can still eat all your favorite food, but you just need to be aware the amount of sugar contained in your food, or it will be a problem to the patients if they did not pump or inject enough insulin before they eat. Thus, it is best just eat according to the food pyramid. Because with a sufficient amount of fats and protein in a meal, it can actually bring benefit to the patients. Because the fats can help in slowing down the absorption of carbohydrates, which the patient body will gain glucose at a steady rate, while the protein can provide steady energy for the body with little effect on blood sugar level. Basically, it's a win-win situation because it can satiate the hunger.
Finally,
so to conclude this, type 1 diabetes is an autoimmune disorder in which the immune system attacks and destroys cells in the pancreas that produce insulin. This can lead to high sugar levels in the blood, which can have severe consequences. Early signs include frequent urination, increased hunger and thirst, and vision changes, but diabetic ketoacidosis can also be the first indicator. In time, complications can develop. Treatment with insulin is necessary for managing diabetes and preventing complications. Having proper insulin intake in the body will avoid having hyperglycemia or hyperglycemia. With treatment, a person with type 1 diabetes can live a full and active life like a normal person.
the end.
So, alright, class. So, you guys have watched what type 1 diabetes is. So, if you guys have any question, then you can just ask me later on. Thank you.